Hey everyone, my name is Erin Tanner. I'm a nurse practitioner for Gastro Health in Birmingham, Alabama. I've worked there for 14 years and see general gastroenterology, which includes hepatology and inflammatory bowel disease. There are a couple questions I get commonly from community gastroenterology APPs about what to do with fatty liver. You know, there are so many things that we see in the clinic as general gastroenterology providers, and patients may come in with a different symptoms such as acid reflux, diarrhea, and then you have an incidental finding on an ultrasound or CAT scan that shows fatty liver. And the question I get often is, what do you do about that? And first, I would suggest is to calculate a FIB-4. That's a very easy test. A lot of our patients have had their transaminases checked, their platelets, then you plug in their age, you get a FIB-4 score. If your FIB-4 is low risk, you can be confident their risk of fibrosis is low. And then you just want to reassess that in 2 to 3 years. If their FIB-4 score is high, then I would suggest ordering another non-invasive test to help confirm their risk of fibrosis. And this can be done with a FibroScan or an ultrasound elastography. But certainly at this point, we cannot ignore an incidental finding of fatty liver on abdominal imaging when they have come in for another issue. Another question I get often is, what do you do if your patient has an F3 fibrosis on a non-invasive test? And with that, certainly encouraging diet and exercise, weight loss, keeping good control of their other metabolic disease states are great recommendations. But at this point, there are so many other options that we can do, such as using Resmetirom. Hopefully soon there will be a GLP-1 out to treat or pose effectiveness in fatty liver. But again, to community APPs, my recommendation is we can no longer just ignore fatty liver seen on an ultrasound or abdominal image. We have to do something about it. Thanks for listening. Have a good day.